Why is it so important? Is because it has immense benefits, no, both on the short and the long term for both mother and child. No, it's not just a mother sacrificing her lifestyle. It's not only nutrition, it's also immunoprotection, di ba? Tumutulong yung mga sangkap, build up their protection, no, against infections, the myriad of infections that are around us.
From med school days, I knew the immense benefits of breast milk for babies. I knew that it would help keep my baby from getting sick because of all the antibodies that we're able to pass on through breast milk. Hi, I'm 𝗕𝗿𝗀𝗀𝗃𝗀𝗃𝗀𝗀𝗀𝗀𝗃𝗀𝗀𝗃, 34 years old, first-time mom, dermatologist by profession, and exclusively breastfeeding for 16 months now. And this is Zoe, my super makulit 16-month-old baby.
Good day. My name is Dr. Maria 𝗷𝘂𝗀𝗁𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀 neonatologist, believe it or not, and I maintained a practice in the neonatal ICUs, no, in 2010, together with other like-minded physicians and a social worker. We founded 𝗕𝗿𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀 financial support towards our vision of eliminating preventable causes of death of both mothers and infants, no?
I'm Dr. 𝗷𝘂𝘀𝗁𝗍𝗂𝗍𝗂𝗍𝗂𝗍𝗂𝗍𝗂 Gynecological Professor of the University of the Philippines, College of Medicine, Department of Pediatrics, Division of Newborn Medicine, and I'm currently the head of the Philippine General Hospital Human Milk Bank Center.
Executive Order 51, or what is nicknamed the Philippine Milk Code, was actually enacted into national law in 1986. It was signed by the late President Corazon Aquino. The Philippine Milk Code largely adopts most of the provisions of the International Milk Code, and it's described one of the strongest milk codes in the world, and one of the earliest, in fact, in Asia. And it's of course a national law to protect breastfeeding, okay, and regulates the marketing, the marketing of what are called breast milk substitutes, na by definition, these are products, whether or not they're appropriate, marketed or presented as partial or total replacement of breast milk.
Protect, promote, and support breastfeeding. For the welfare and health of the Filipino children, please do not break the milk code. There should be no promotion of breast milk substitutes, breast milk supplements, feeding bottles, teats, pacifiers in health facilities with maternal and neonatal care services.
The law is designed to protect breastfeeding, that we know is probably the number one, public health intervention to protect children against dying. So it's a very crucial piece of legislation because they are designed to protect us.
I was decided on breastfeeding even before I got pregnant. From med school days, I knew the immense benefits of breast milk for babies. I knew that it would help keep my baby from getting sick because of all the antibodies that were able to pass on through breast milk. And when the pandemic hit, it further strengthened my resolve to be able to breastfeed to keep her healthy. Secondary reason, of course, was knowing that it would help me shed all my pregnancy weight that I had gained more quickly. And of course, syempre, mas tipid. And right now, at 16 months, I find even more reasons to continue. Zoe breastfeeds every few hours, even until now. And after a long day at work, I come home home and see her, eyes light up and with an excited smile goes, "Mama, Dede, please, milk, please." And suddenly all the stress from a tiring day disappears.
Let's go first with the child. No, it's not only nutrition, it's also immunoprotection, di ba? Tumutulong yung mga sangkap ng breast milk, gatas ng ina. For example, taglay ng gatas ng ina yung tinatawag na antibodies. It also contains stem cells, no? Even newborns at the time of birth build up their protection, no, against infections, the myriad of infections that are around us. Tumutulong yung colostrum sa unang boost, no, of antibodies. In fact, it's described as the first vaccination of a child, and therefore yung isa naming pinupush na advocacy, yung breastfeeding initiation through the unang yakap protocol is so very important to us, especially amidst this pandemic, no? So protecting, supporting, and promoting breastfeeding, no, as part of the so-called global infant and young child feeding strategy is all important. It's a set of evidence-based recommendations that state that optimal feeding for growth and development of the children, of young children, starts with exclusive breastfeeding in the first hour of birth. Dito, dinidiin natin sa Pilipinas, no?
When Zoe was 4 months old, my husband, who is an ER doctor, he got sick with COVID. 1 month later, after he recovered, my dad naman got sick also. And honestly, it was really one of our most difficult times. I was isolated with Zoe alone, while trying to coordinate with no one to help me take care of her, because we both had very close contact with both my husband and my dad. And I was so scared of Zoe getting sick, so I continued to breastfeed on demand. Awa ng Diyos, we finished our isolation healthy, and both Zoe and my RT-PCR results came out negative on both occasions. I always think it was because of my breast milk that helped keep Zoe safe both times. So we push on, and now that I've been fully vaccinated, I am really hoping that my antibodies from the vaccine somehow reach Zoe too, and gives her some level of protection, especially now that the Delta variant is in the country and is known to affect children more.
So in this COVID-19 pandemic, continue exclusive breastfeeding and kangaroo mother care for stable, premature, and low birth weight infants. Mother who is COVID-19 suspect or confirmed should maintain the use of face masks and perform frequent hand washing. Cough and sneeze into a tissue disposed immediately in proper bin, and disinfect frequently handled surfaces like cellular foam, doorknobs, and others. Please take note that breast milk is not a vehicle for COVID-19 virus transmission. It is safe to receive COVID-19 vaccines among lactating women. And the evidence show that COVID-19 antibodies are found in the breast milk of infected women, as well as those mothers vaccinated against COVID-19 virus.
And it's not just nutrition. For the child, it's also, in fact, long-term. It prevents actually obesity and so-called lifestyle adult onset diseases. For example, yung tinatawag na metabolic syndrome, which is an overlap syndrome between diabetes, overweight, obesity, coronary artery disease, heart attacks, other cardiovascular morbidities, no? How you start a child on infant and young child feeding, no, actually impacts even on the long term.
The Human Milk Bank is a service established for the purpose of screening, collecting, processing, storing, and distribution of pasteurized donor milk to meet the specific needs of premature babies and sick neonates. For mothers who have extra breast milk, please donate your milk. Your milk could save these newborns. But please remember that the pasteurized donor milk would only serve as a temporary solution to provide neonates with no access to their mother's breast milk, accessible only with a physician's prescription.
as a pediatrician, no, I'm a neonatologist, no, I've seen the health and how exclusively breastfeeding babies grow and develop so nicely, no, so beautifully, so free from hospitalizations, no. Wag ho kayong makinig dun sa mga commercials, no. Try to filter the messaging na umaabot sa inyo, no. Sana choose breastfeeding and talk to your physician or your midwife. Many physicians will be happy that you open up to them and discuss your choice of breastfeeding para pati yung inyong kagustuhan na mag-unang yakap, maganda ang magiging umpisa ng inyong breastfeeding journey, kung tawagin ng mga mothers ngayon, no? Pag-usapan na po ninyo. That's your right, no? So that you can fulfill your entitlement and your needs, no? Dun sa pagbubuntis ninyo.
So to all you mommies, just remember that we got each other's backs. It's going to be difficult, it's going to be painful, but it will all be worth it. It helps to be informed, it helps to know what to expect, and just don't forget that you can always ask for help. We need all the help we can get. It's so difficult being moms, and it helps to be surrounded by people who support you and believe that you can do it.
Message ko is study, discuss your choice of breastfeeding sana with your healthcare provider. If you're able to observe unang yakap delivery, marami po sa difficulties ng early days and weeks of breastfeeding mape-prevent po. There are also a lot of mother support groups now, no? And what you want is train mother support, no? In peer counselors, no? There are a lot of peer counselors in communities, even at the community level, no, na willing pong tumulong sa inyo, having come from possibly difficult experiences themselves, no. So seek help. Yung theme ng ating National Breastfeeding Awareness Month ngayon is tulong-tulong sa pagpapasuso sa first 1,000 days, no. So it's a very succinct, no, it's a very concise message, but very, very true, no. Short but true, that breastfeeding is not the burden of just one woman, no, starting off on her breastfeeding journey. We have to help pregnant girls and women, no, through this amazing journey that they're about to take, no, because if you think about it, breastfeeding pregnant and breastfeeding mothers are rearing our next generation, no. They're responsible for nurturing our next generation. What we should be doing is supporting them, their environments, in the family, in the barangays, communities, and even in the local government units, no. Especially itong pandemic na to, it's even harder.
If a new vaccine became available that could prevent 1 million or more child deaths per year, which is cheap, safe, and administered orally, and no cold chain is required, it would become an immediate public health imperative. And breastfeeding can do all of this and more, but requires its own cold chain of support. Support from her partner or husband and the rest of the family members, her trusted healthcare provider, her friends, the community, the mother support groups, her employer, the government, NGOs, and medical societies. Tulong-tulong tayo to protect, promote, and support breastfeeding.